Hello guys, welcome and welcome to Metier International Academy, one of leading academy in training nurses and nursing competitive exam as well as IELTS and CLEX and OET training. Welcome back to Magic Pill session. As you all know that in Magic Pill session, we are discussing very important topic which is already asked in the previous year question paper. The questions means MCQ questions and the related golden points, everything we are discussing in detail. So definitely it will be so much useful for you for the upcoming examinations. And let's begin the session with a thought of the day. And the thought is success is the sum of small effort repeated daily. Small effort repeated daily will make you to the success. Okay. So with this thought, let's begin the session. As I mentioned already, the topic what we are going to discuss today, it is immunology. It is from immunology and in specific hypersensitivity reaction. Okay, because most of the students demanded for hypersensitivity reaction class. That's why I have added this topic here. Okay, fine. So in immunology, mostly we are going to start and discuss about hypersensitivity reaction. So if you like the video, please like it, share it. And without subscribing, if you are watching means, please subscribe the channel so that it will give more, motivation for us to post more and more videos. So let's begin the session. The first question is, a 25-year-old woman present with a recurrent episode of joint pain, skin rashes, and photosensitivity. So that is the first point. Second point, her lab result shows positive ANA. ANA means anti-nuclear antibody and anti-DS DNA antibodies. So this is the second point. In second point, they says that lab reports anti-nuclear antibody is positive and anti-DS DNA antibody is also positive. Okay, so this is the second point. In the first point, they said about the clinical manifestation. In second point, they are talking about the lab investigation. And in the third point, they are asking which type of hypersensitivity reaction the person is suffering from. Okay, so these are all the 3 points which is present in the question. In the 3 point, the second point, that is the lab values, if you see, means they said that positive anti-nuclear antibody and positive double stranded DNA antibody. So these two things are positive. In which disease condition these two things are positive? Yes, systemic lupus erythematosus, SLE. In SLE, double stranded DNA antibodies will be positive. That is the confirmatory test. In order to confirm the systemic lupus erythematosus, what test we supposed to do? We have to check for anti-double stranded DNA antibody, which is mentioned here. Is that clear, guys? Yes. So based upon this point only, I have decided which disease the patient is suffering from, systemic lupus erythematosus. So I got 1 point, that is systemic lupus erythematosus. So now I have to search for the related option of systemic lupus erythematosus. Among these 4 options, which is related to systemic lupus erythematosus, I have to decide about that, right? Fine. So for that, first you should have the idea of different type of hypersensitivity reaction. One by one, I will discuss about that. Please listen carefully. If you are having paper and pen, please write it out. It is very, very important for your exams. So 4 types of hypersensitivity reaction is there, guys. Okay. So the first one is type 1 hypersensitivity reaction. It is also called as IgE mediated hypersensitivity reaction. 2 more names are there. It is also called as allergic hypersensitivity reaction, also called as anaphylactic hypersensitivity reaction. So let me repeat once again. Type 1 hypersensitivity, IgE mediated hypersensitivity, allergic reaction or anaphylactic reaction, all are same. Okay, so in type 1 hypersensitivity reaction is nothing but there is a allergic reaction happening immediately. Immediate allergic reaction is happening. Okay, so that is called as what? Type 1 hypersensitivity reaction. In this type 1 hypersensitivity reaction, 4 things will be increased. Which one? 4 things will be increased in the type 1 hypersensitivity reaction. Please write it out. The first one is IgE, which is already mentioned here, IgE. And second one is mast cells. Mast cells is also a type of WBC. This one will also increase in type 1 hypersensitivity reaction. And the next one is basophils. The basophils level will be increased in the type 1 hypersensitivity reaction. Whenever the basophil level is increased, histamine level will also increase. Okay, histamine level will also increase. So type 1 hypersensitivity reaction is an immediate allergic anaphylactic reaction where IgE, basophil, histamine, mast cells, everything will be increased. So this is all about the type 1 hypersensitivity. Type 2 hypersensitivity reaction is also called as what? Cytotoxic reaction. What is that? Cytotoxic reaction. What is cytotoxic reaction? Cytotoxic reaction is also called as cell-bounded reaction. Because you know why it is called a cell-bounded reaction? Our body will produce the antibody against the cells. Against the cell. For example, you can take, this is a RBC. RBC, it will having what? Antigens. RBC will have what? Antigen. Okay. So our body will produce autoimmune antibodies, and these autoimmune antibodies will only target the cells. Like RBC. Like what? RBC. Only target the cells. See, that's why it is called as what? Cell-bounded. So type 2 hypersensitivity reaction is also called as what? Cytotoxic reaction, also called as cell-bounded reaction, because autoimmune antibodies from our body, it is going to target only the cells which contain the antigens. Which contain the antigens. Most commonly, which cells will get affected in type 2 reaction? You know, RBC. Especially type 2 hypersensitivity reaction, commonly we have to see for the patient who is undergoing blood transfusion. If there is any ABO incompatibility, mismatching of the blood group, that time hemolytic reaction is taking place. Why it is happening? Because of the antibody which is produced and it is destroying the donor RBC. So donor RBC is getting destroyed and hemoglobin will be released and it leads to hemoglobinuria. Understand? Right? So what I want to conclude is type 2 hypersensitivity reaction is also called as what? Cell-bounded, because autoimmune antibody will only focus the cells. Okay, and next important point in type 2 hypersensitivity reaction, two things will be elevated in the type 2 hypersensitivity reaction, that is IgG and IgM. IgG and IgM both are immunoglobulins, antibodies. So these two things will be elevated in type 2, right? And the next one is type 3. What is type 3? It is little bit same to type 2, but it is not cell bounded. Type 3 is not cell bounded. In type 2, as I said already, it will focus only on the cells like RBC. But type 3 is not a cell bounded. In type 3, it is called as immune complex mediated. Immune complex mediated means always you supposed to remember antigen antibody reaction. Mostly this antigen and antibody, it will travel in the blood and it will go and stay in a particular area. For example, it will antigen antibody, it will travel in the blood and it will go to the kidney, it will go to the skin, it will go to the liver, it will go to the skin, and it will cause some inflammatory reaction. Right? So that is called as what? Immune complex mediated reaction. Suppose if the antigen antibody reaction, it is happening in the kidney, and it will cause what? Glomerulonephritis or pyelonephritis, whatever. So the kidney is going to get damaged. So this is called as what? Immune complex mediated reaction. Okay, yes. And systemic lupus erythematosus is one of the best example of immune complex mediated. Okay, so that's why I said that. See, by means of reading this word anti-DS DNA antibody, this is the confirmatory test. What is that? Confirmatory test for what? SLE, systemic lupus erythematosus. If the patient is suffering from systemic lupus erythematosus, we have to do a confirmatory test, and the name of the confirmatory test is anti-DS DNA antibody. And systemic lupus erythematosus is the best example of what? Type 3 hypersensitivity reaction. Clear? Yes, because in SLE, systemic lupus erythematosus, the antigen antibody is traveling in the blood and it will go and reach the skin, joint, kidney, liver, wherever. It will deposit and it will create what? Inflammatory reactions. Okay, fine. So in this question, the right answer is going to be option C. And also I have given the vital points related to type 1, type 2, type 3. See, type 3, one more additional point I would like to add here. Please write everything what I am saying. Okay. In type 3 hypersensitivity reaction, again IgG, IgM level will be increased, same like type 2. In type 2 also IgG, IgM antibodies level will increase, and in type 3 also IgG, IgM antibody level will increase. But type 2 is a cell bounded, but type 3 is not a cell bounded. The antigen antibody will travel in the blood and it will stay in a particular organ and create inflammation. That is called as type 3, immune complex mediated. Clear? And type 4 is delayed type hypersensitivity reaction. Here, T lymphocytes plays a vital role. For example, I am allergic to gloves, powder in the gloves. Okay. Today I am wearing the gloves with the powder, and tomorrow or day after tomorrow I am getting some allergic reactions. Delayed, not immediate. Immediate means it is coming under what? Type 1. Delayed means it is coming under what? type 4. In type 4, T lymphocytes level will be increased. Once again, I will repeat. In type 1, IgE, basophils, histamine, mast cells level will be increased. Type 2, IgG, IgM level will be increased, but it is cell bounded. Type 3 is not a cell bounded. Here also IgG, IgM level will increase. Type 4, T lymphocytes level will increase. Understand, guys? So these are all, this is the brief introduction about the hypersensitivity reaction. If you know this concept only, you can solve the questions. Okay, fine. So hope everyone understand the concept, right? So for this question, I have already given the answer, and the right answer is going to be type 3. Option C is the right one. That is type 3 immune complex mediated, because it is related to SLE. Okay, so that's why we have selected type 3, that is immune complex mediated. Okay, and I have given the rationale also. Please go through it. Okay, guys, fine. So whatever I have discussed with you, everything I have given in the rationale. Okay, and the next question. A patient receives a mismatched blood transfusion. Very important question. This question already asked in the competitive exam. A patient receives mismatched blood transfusion. Matlab ABO incompatibility. It means what? ABO incompatibility. Actually, the patient is A blood group, but what blood he received from the donor? B blood group. For example, I am the patient. I am A positive, but what blood I have received? I got transfused is B positive. So what will happen? ABO incompatibility happened. Okay. So now, immediately after this transfusion, I'm getting fever, chills, hypotension, and hemoglobinuria. What is the main immunological mechanism? Here also they are asking about the hypersensitivity reaction. Okay, so A blood group person received a B blood group blood transfusion. What will happen? Which hypersensitivity reaction will get triggered? So this is the question. Type 1, type 2, type 3, type 4. Which is the right answer? Okay, for example, you can see here A blood group person, but he received a B blood group transfusion, blood transfusion. Okay, so usually you have to see this is the cell. Which cell? RBC. Okay, RBC, and you can see these are all the antigens. What is this? Antigens. Okay, fine. So RBC cell, it is having some antigen. Which antigen the RBC is having? B antigen. That's why the person is having B blood group. See, the blood group is based upon the antigen presenting in the RBC. Blood group is based upon what? The antigen which is present in the RBC. For this person is having B antigen. For this person, he is having A antigen. Clear? So both the antigens are different. That's why the blood group is also different. Okay. So make it simple, guys. See, A blood group person receiving a B blood group blood. Immediately what will happen? Antibodies, autoimmune antibodies, it will develop and it will destroy the RBC from the donor. Okay, see, I am A blood group and I am receiving B blood group blood. Immediately in my body, antibodies will be developed and it will destroy the transfused blood. B blood group which is transfused to me, it will get destroyed. In specific, which one will get destroyed? RBC of the donor blood will get destroyed. If the RBC is destroyed, that is called as what? Hemolytic reaction. Hemolysis means destruction of the RBC. Once the RBC is destroyed, what will come out? Hemoglobin will come out. That's why here the patient is having what? Hemoglobinuria. So on the whole, what you're supposed to think is, this autoimmune antibody, it is focusing on the cells like RBC. If the autoimmune antibody is focusing on the cell, means it is called as cell bounded or cytotoxic reaction or type 2 hypersensitivity reaction. So here, which is the right answer? Option B, that is IgM mediated complement activation. This is the other name of type 2 hypersensitivity reaction. Type 2 hypersensitivity reaction or cell bounded or cytotoxic reaction. It is also called as what? IgM mediated complement activation. See, actually in this question, they are said about the ABO incompatibility. Because of ABO incompatibility, hemolysis is taking place. Whenever there is a ABO incompatibility, hemolysis, IgM level will be increased in the type 2 hypersensitivity reaction. What will be increased? IgM level will be increased in the type 2 hypersensitivity reaction. So here also they mentioned very clearly IgM mediated complement activation means after this blood transfusion, immediately the IgM level is increased and it is destroying the RBC of the donor. Okay, so that's why we have selected what? Option B as the right one. Okay, hope you understand the question, right? Fine. So for this question, the right answer is option B, that is IgM mediated complemented activation, because whenever there is a ABO incompatibility, IgM level will be increased in type 2 hypersensitivity reaction. Okay, guys, fine. The rationale I have given here, please go through it. And the third question is, a 6-year-old child has recurrent respiratory infection. Please listen, this question also already asked in the exam. Recurrent respiratory infection, first point. Absence of tonsils, there is no tonsils at all, and marked reduced B lymphocyte count. This is the key point. Every question there will be a key point. So for this question, this is the key point. B lymphocyte count is reduced. Okay, fine. On flow cytometry, flow cytometry is nothing but it is the study of the cells present in the fluid. Study of the cells present in the fluid, that is called as what? Flow cytometry. The fluid might be your respiratory fluid like saliva, or peritoneal fluid, or pleural fluid, or pericardial fluid, or blood, whatever it is, amount of cells present in the fluid, that is called as what? Flow cytometry. Okay, so here what they are saying is the patient is having recurrent respiratory infection, tonsil is absent, and B lymphocyte count is reduced. That is the main key point. B lymphocyte count is reduced, which is the most probable diagnosis. This is the question. Here the key point is B lymphocyte count. Okay, it is reduced. Let's see the options. Severe combined immunodeficiency. What is combined immunodeficiency? Combined means two. See, deficiency of T lymphocytes and B lymphocytes both are deficit means, that is called as what? SCID, severe combined immunodeficiency. But in the question only B lymphocyte is reduced, so it is not a severe combined immunodeficiency, so we can eliminate this option. Okay, and second one is X-linked A gamma globinemia. Yes, X-linked A gamma globinemia. It is also called as Bruton's tyrosine kinase. Okay, fine. We will discuss about this option B later. Okay, and the third option is Dye-George syndrome. What is that? Dye-George syndrome. In Dye-George syndrome, only T lymphocyte level will be decreased. Which one will be decreased? Only T lymphocyte. But in the question, B lymphocyte level is decreased, right? So this option also we can eliminate. And selective IgA deficiency. See here directly they have said that IgA deficiency. It is nowhere related to this question. Right? So which option is left? Option B is left. What is option B? What they are saying in option B? See, option B, that is X-linked A gamma globinemia, that is Bruton's tyrosine kinase. In this disorder, what will be reduced? B lymphocyte level will be reduced. What will be reduced? B lymphocyte level will be reduced. Okay, in this question also they said that B lymphocyte count is reduced. So here in X-linked gamma globinemia also B lymphocyte level is reduced. So option B is the right answer. Once again I will repeat, guys. Severe combined immunodeficiency means T lymphocyte, B lymphocyte both will be reduced. So it is not at all related to this question. Dye-George syndrome means T lymphocyte level will be reduced. But here what they are asking, B lymphocytes. Selective IgA deficiency, already they have mentioned it is a IgA deficiency, so it is also nowhere related here. So at last, which is the right answer? Bruton's tyrosine kinase. So here in this disorder, the B lymphocyte level will be reduced. So that's why we have selected option B. Okay, fine. So this is how your exams question is going to be. So be careful and please do the revision of each and every video what we are posting in the Magic Pills. Okay, so rationale have given here. Please look into it. Okay. And the fourth question, a 32-year-old nurse developed itchy rash and vesicles on her hand 48 hours after wearing the latex glove. So this is the key point, guys. 48 hours after wearing the latex gloves. Immediately after wearing the latex gloves, if the allergic reaction is happening, that is called as what? Type 1 hypersensitivity reaction. But what they have said here, after 48 hours, after wearing the gloves, I have wear the gloves now. After 48 hours, immediately they are getting the allergic reaction. Okay. So this 48 hours gap is there, right? So this one is called as what? Delayed. After wearing, immediately allergic reaction, that is type 1. But here they said that after wearing, they have maintained a gap or for 48 hours. After wearing the gloves, 48 hours gap is there. And then only they are getting the allergic reaction. In that case, it is called as what? Delayed hypersensitivity reaction. In this delayed hypersensitivity reaction, which cell level will be increased? T lymphocyte level will be increased. T lymphocyte level will be increased. So which is the right answer? After 48 hours means it is a delayed type. So option D is the right one. Okay, guys. So the next one is a 4-month-old boy developed persistent oral thrush and chronic diarrhea, failure to thrive. The blood test shows very low lymphocyte count. See, here they doesn't mention T lymphocyte or B lymphocyte. Simply they have mentioned low lymphocyte count. Okay, so this is the key point. So low lymphocyte count means it includes both T lymphocyte and B lymphocyte. Specifically, they doesn't mention only T lymphocyte is reduced, only B lymphocyte cell is reduced. They doesn't mention like that. Overall, they have mentioned lymphocyte counts are reduced. It means both T lymphocyte and B lymphocyte both are reduced. Right. So, and also the patient is going for what? Bone marrow transplantation, because lymphocytes are not there. So bone marrow transplantation is planned. Okay. So what condition or what diagnosis the patient is suffering from? This is the question. Okay. Already we got the key point, that is low lymphocyte count. Matlab T lymphocyte and B lymphocyte both are reduced. Okay. Fine. So let's see the option. Severe combined immunodeficiency. In severe combined immunodeficiency, already I said that T lymphocyte, B lymphocyte both will be reduced, right? So here also in this question also they said that low lymphocyte count means T, B both are reduced. So this one will make you to select option A. X-linked gamma globulinemia, what will happen? Only B lymphocyte count will be reduced. Chronic granulomatous disease. In chronic granulomatous disease, only the neutrophils level will be reduced. Okay. And Dye-George syndrome, what will happen? Only T cell level will be reduced. But here they doesn't mention any T cell or B cell. Simply they have mentioned lymphocyte. It means both T and B are included in that. Okay. So that's why we have selected option A, that is severe combined immunodeficiency, because in that both T and B lymphocytes are included. Okay, guys. So this is all about the question. So here the right answer is option A. I have given the reasoning for each and everything. Hope you understand each and every question, guys. If you have any doubt anywhere, you can drop your message in the chat box. Hypersensitivity reaction is a very important question, and also we have discussed about various new questions which they can ask in the future. Okay, so each and every point is a golden point. Please go through it. Watch the video 2 or 3 times for getting the better clarification. So if you have any doubt anywhere, you can drop your message in the comment section also. And all the best for your upcoming examination, guys. Thank you very much for watching the video.